I'll begin upon entering the patient's room. I'll close the door to ensure patient privacy, perform hand hygiene, and apply clean gloves. Hello, Mr. Attell. My name is Bessie. I'll be your nurse. May I see your wristband? Thank you. Can you tell me your first and last name and your date of birth?
January 21st, 1987.
Thank you. I'll be performing a head-to-toe assessment. Is that all right?
Yes.
Okay. Are you experiencing any pain today?
No.
Can you tell me where you are right now?
At the hospital.
And can you tell me today's date?
July 21st, 2024.
Thank you. My patient has told me his name and date of birth, location and date, alert and oriented times 3. Okay, first I'm going to start assessing your head. Hair is evenly distributed, no missing or thinning hair. Now I'm going to check the temporal pulses. Temporal pulses are, the rate and rhythm is equal bilaterally. Now I'm going to assess skin turgor. I'm just going to lightly pinch your skin. And can I see your hand? Skin turgor is non-tenting. Now I'm going to assess the skin further. For the purposes of this video, my patient will keep his clothes on, but I'll assess as if I'm looking at his skin under his clothes. Skin, arms, hands, other arms. Check chest, abdomen, back, hips, legs. Let's see your leg. No lesions, abrasions, rashes, or lumps noted. Are you experiencing any tenderness today?
No.
No tenderness reported. Now I'm going to check the bony prominences. Checking the hips. No skin breakdown at the bony prominences. Now I'll check the nail beds. May I see your hands? And your toes? No cracking or denting in the upper and lower extremity nails. Capillary refill is less than 3 seconds in the fingernails and toenails. Now I'm going to check your eyes. Eyes look symmetrical. I'm going to check the conjunctiva and sclera. Go ahead and look up. No swelling or discharge noted. Sclera is white. Now, Mr. Attell, I'm going to shine a light in your eyes. Please keep looking at me. Good. Now follow the light. Thank you. Pupils are equal, round, and reactive to light. Accommodation bilaterally. Now I'll check the ears. No discharge noted. Tympanic membrane is intact. No discoloration or swelling. Now I'll check the nose. Palpating the nose. Nose appears symmetrical. Now I'll palpate the sinuses. No swelling or tenderness noted. Now I'll check the midline and nostrils, the septum and nostrils. Septum appears midline, nostrils are moist and intact. Mr. Patel, can you close one nostril with your finger and breathe in and out with the other? Good. Now the other side. Good. Is intact bilaterally. Any issues with your smiling lately?
No.
No. Can you tell me what this smells like?
Alcohol.
Yeah, that's an alcohol swab. Thank you. Okay. Now I'm going to assess the lips. Lips appear intact, moist, and normal in color. Can you open your mouth and lift your tongue back down? Thank you. Teeth and gums appear normal, no swelling, discoloration, cracking, or bleeding. Buccal mucosa is moist and intact. Palate is upwardly movable. Tonsils, uvula, and tongue appear normal, no discoloration or swelling. Now I'm going to palpate your lymph nodes. No swelling or tenderness noted. Now I'm going to palpate the neck and trachea. Trachea appears midline. Now I'm going to assess for JVD. No distension or JVD noted. Now I'm going to assess the carotid pulses. Carotid pulse normal rate and rhythm equal bilaterally. Okay, Mr. Patel, can you take your left ear without moving your left shoulder? Put your ear all the way down to your shoulder. Okay, now the other side. Wonderful. Can you extend your neck all the way back and all the way forward? Okay, back to normal. Can you put your neck in a round position? Thank you. Range of motion intact. Now I'm going to put my hand on your shoulders. I'm going to push down, push up when I push down. Thank you. Shoulder shrug with resistance equal in strength bilaterally. Okay, Mr. Patel, are you experiencing any coughing or shortness of breath?
No.
No? Okay, I'm going to place my arms on your chest and your back. Take a deep breath when I tell you. Take a deep breath. Take a deep breath. Take a deep breath. Okay, can you this way so I can put my hand on your back? Take a deep breath. Thank you. Okay. Breathing unlabored, no accessory muscles used, chest expansion level and symmetrical bilaterally. Now I'm going to listen to your lungs. Take a deep breath. Take a deep breath. Again. 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 Thank you. We're going to do the same on your back. Can you move this way? Thank you. Take a deep breath. Take a deep breath. Again. Okay. Again. Last time. One more time. Thank you. Lung sounds in posterior and anterior lobes clear, no adventitious sounds. Now we're going to listen to your heart. Start the aortic, pulmonic, Erb's point, tricuspid, and mitral. Heart rate, normal. Heart sounds normal rate and rhythm. Okay, Mr. Patel, now I'm going to assess your abdomen. Have you experiencing any issues with your bowels or your bladder?
No.
And when was your last bowel movement?
Today.
Today? Okay. Can I have you lay down? I'm going to assess your abdomen. In the abdomen, no distension or discoloration noted. Now I'm going to auscultate starting at the right lower quadrant. Vowel sounds are active in all 4 quadrants. Now I'll palpate. Any pain or tenderness?
No.
Abdomen is soft, no pain or tenderness noted. Okay, Mr. Ertel, I'm going to use this pen to poke certain parts of your body. Just go ahead and tell me if you feel the soft or the sharp side. Can you close your eyes? Okay, you can open your eyes now and you can sit back up. Sensory function intact. Okay, Mr. Attell, can you go ahead and spread your arms out like this? And with your left finger, go ahead and touch the tip of your nose. Now the same with the other side. Again, with the left hand and the other side. Thank you. You can put your arms back down. Now, can you move your index finger to your thumb rapidly? Good. Now the other side. Okay, now with each digit of your hand, go ahead and touch your tongue rapidly, back and forth. Good. Now the other side. Good. Now go ahead and touch with your finger, touch my finger, and then touch your nose. Awesome. With the same finger. Touch the finger in your nose, my finger, your nose, my finger, and your nose. Okay, the other hand, my finger, your nose, my finger, your nose, my finger, your nose. Thank you. Now, with your heel, touch the opposite knee and go down your shin. And the other knee. Thank you. Coordination is well balanced. Okay, Mr. Ertel, after coordination. Are you experiencing any joint pain?
No.
Okay, I'm going to assess your reflexes. I'll start with your arms, then your legs. I'm going to use this as my reflex hammer. Take a great deal. Arm out like this. Down. Other arm. Bicep. Down. Now your top. Other top. And your Achilles. Achilles. All reflexes are 2+. Now I'm going to check your gait. If you could please stand and walk to the end of the wall and come back. Okay, keep facing me, gait is steady. Now I'm going to check your range of motion and your strength. If you could go ahead and move your arms out like a T. Okay, don't let me push down. Don't let me push up. Now I'm going to stand right here. If you could put your arms all the way forward and all the way back. Okay, now lift your arms all the way up behind your head and behind your back. Okay, and go ahead and move your arms in a circle. Okay, now put your arms all the way back again. Don't let me push in. All the way back to your back. Don't let me push in. Good. Now can you go ahead and put your arms straight forward. Move your wrists inside out. Good. Again. Okay. And with your palms facing up, go ahead and bend your elbows all the way forward. Don't let me push back. Keep going. Keep pushing your arms forward. Keep going. Keep going. Good. Now extend your arms out. Don't let me push up. Keep going. Keep going. Excellent. Okay, now with your wrists, can you go ahead and put them up and down? Good. Just release your arms. Thank you. And now shake your wrists. Okay, down to your wrist. Don't let me push up. And don't let me push back. Okay. With your fingers, go ahead and spread them out and then back in. Now, can you go ahead and grab my fingers as tight as you can with your hands? Thank you. Okay. If you could with your legs or with your back, bring all the way forward. Good. Now all go as far. Now stand back up and go as forward as you can with your back. Thank you. Can you go from side to side? Thank you. And can you go ahead and push your leg as far forward as you can? We're going to move you facing this way a little more forward because you're going to push your leg back. Okay. Move your legs as far forward as you can and as back. Now with the other leg. Now we're going to have you take your leg back. And the same with the other leg. Okay, thank you. You can have a seat. Now I'm going to push on your knees. Don't let me push in. Don't let me push out. Same thing with your shins. Don't let me push forward. Don't let me push back. Okay. Now with your feet, don't let me push down. Don't let me push up. That's fine. Can you rotate your ankle in a circle? Now the other side. Okay, now can you point your ankle as far down as it can and back up? The other side, down, up, down, good. Now, are you able to lift your toes up and down? Squeeze your toes, squeeze. Good job, okay. Range of motion and strength in upper and lower extremities equal bilaterally. The Glasgow Coma Scale is unnecessary. My patient has been responding coherently and following instructions adequately. I'll then remove my gloves. Perform hand hygiene and educate my patient. Mr. Ertel, your skin trigger was non-tempting. That means you're nice and hydrated. However, just be sure to make sure that you're drinking at least 15 cups a day to stay hydrated. That not only hydrates your skin, but also your organs and helps everything function. For additional skin protection, it's best to use sunscreen at least SPF 30 while out in the sun. Do you have any questions?